Hello everybody, my name is Mark Ayre, and in today's video demonstration, I'm going to run through all of the basic functions of the Brightsquid secure mail service, from composing messages, attaching files, addressing messages to patients and colleagues, and managing incoming messages from the same. I would encourage you throughout today's video to pause and rewind and take a close look at some of the information that I'm providing. Now, be aware, this is not the only training that's available to you. We do hold training courses. We host them on GoToWebinar, usually about 2 times a week. And you can find information about that on our website by going to brightsquid.com and looking for the Secure Mail training section under the Secure Mail heading. Also, you can always contact our help and support department by going to support.brightsquid.com and connecting with our customer service team. They're always happy to answer questions that you might have about how to do certain tasks and can even do a little ad hoc training session if that's ever required when you're looking for answers to specific questions. But let's get started and take a look at how secure mail works. Now, I'm going to start in a little bit of an unorthodox fashion where instead of starting in secure mail, I'm going to start in my regular old-fashioned email account. Now, in this case, I'm currently displaying my Gmail account for an email user called test user. Now, it's obviously a test account, but this is how most of our users get invited to Brightsquid to begin using the service. That is to say, your practice administrator, be that your privacy officer, your lead medical office administrator, or even the doctors in your office, may send you an invitation to join the team. And this is how that process will look from the very beginning. Now, it's important to review this process because this is the same type of process that patients and other providers that you will soon be communicating with will also get exposed to Brightsquid Secure Mail. So it's a very important process, and I think it's a good place to start. So in this example, if you're viewing my screen now, you'll notice that I'm at my regular old-fashioned email account, and I have a message that says, complete your secure mail registration with the Fauchard Clinic. So in this example, what I've done, and you can see that I've done a couple tests here. Let's look at the one here from Marty. So this is a message that was just sent him a few minutes ago, and it's an invitation to Marty to register and become a secure mail user. Now, the call to action, of course, is this complete registration button here in the center of the screen, and that's where Marty will go to register their account and become a secure mail user. So let's go ahead and click on that link now. But one thing before I do that, I want to point out that every step of the way, you can always access our help and support team. There's a little link down here at the bottom of every email that will allow you to get in touch with someone to provide assistance. But let's go ahead and click on registration. Now, because I've been invited to join an existing practice, when I start the registration process, most of the information about who I am and where I'm logging into is already entered for me. So my name is Marty McFly. I am working at the Fauchard Clinic at this pretend address in Calgary and Alberta Medical Clinic, and I'm a staff member. In some cases, this will be customizable information, but in most situations, if you're joining an existing practice, in this case, the Fauchard Clinic, the only thing I can really change on this page is my salutation. Let's change that to Mr. And I want a more formal appearance, so I'll call myself Martin McFly in this example. The rest of the information is locked down. That is all customizable by your practice administrator. More on that in a few minutes. So I'll confirm this is the right information. I need to establish a password for my account. So I'll type in a password now, and that's it. Now I will just agree to the terms of use, which of course I would encourage you to click on and read, and we'll skip that for today, and then click on go to your inbox. Now, once I register as a Brightsquid Secure Mail user, now is when I will get my first look at how Secure Mail looks on my browser. Now, a couple things that I normally would point out early on in these kinds of conversations is that Secure Mail is an entirely web-based application. So what I mean by that is, as a web-based application, there's two key things to remember. First and foremost, it's accessible anywhere. Secure Mail is not an installed application on your computer. You can access the service from anywhere in the world so long as you're connected to the internet. Add to that the second important point Because we're web-based, there's no software or apps or configuration that need to be done on your devices to use Secure Mail. It is truly flexible and available through the web browser. So that includes Windows computers, Mac computers, iPhones, iPads, Android devices. Essentially anything connected to the internet with a modern web browser can log into Secure Mail and get access and use the system. And that holds true for our professional users, of which most of you probably are, as well as the patients that I'm going to show you how we'll invite in just a few minutes. Now, if you're seeing Secure Mail for the first time right now, you're probably saying to yourself, this looks a lot like regular email. And that's absolutely true. Secure Mail was designed deliberately to look and feel much like traditional email. So as I was talking just now, I went ahead and I opened up a message that I received a few moments ago from Fred Flintstone. Now it's interesting, you'll notice that I just created my account 5 minutes ago, but I've already got messages in my inbox that were sent to my address earlier. And that is an important key about how Secure Mail works in a team-based organization. Unlike traditional email, which is typically one person, one user, and so on, within Secure Mail, we have this concept of the shared inbox. And the shared inbox allows multiple users to monitor incoming messages to the practice. And those multiple users, let's call them the office staff, all of those people will work together and collaboratively to deal with these incoming messages. The overriding principle behind this is what we call the virtual front desk. And as a member of the virtual front desk, I'm receiving these messages from the patients or from other professionals. And when and where it might be appropriate, I can forward them off to the doctor, or I can take information a patient has sent me, download that information. I could download a file, or I can print the body of the message to a PDF document, or I could do both, and import that information into my EMR and then assign a task to a provider who works in the same practice as me. But really what I'm driving at is this is a shared inbox, and within this practice where Martin works, there are several coworkers that have access to this shared inbox. More on that in a few minutes. Now let's take a look at this message Fred sent us. So I wanted to share this photo with you. Do you think I need to come in? And if we take a closer look at the photo, now our patient Fred may have taken this picture with his phone, and that's just fine. And now we can zoom in and get a higher resolution, picture of this, in this case, what looks like, well, I shouldn't speculate, but I know that's probably eczema. At any rate, we'll just close that down now. So now that I've viewed the information that the patient has sent to me, I can make a decision to reply back to the patient, forward it off to my doctor, or as I mentioned before, download the photo, download the body of the message, and import them into my EMR for further actions. You know what? Just for the sake of demonstration, I'm going to reply back to Fred directly. So like email, I'll just click on the reply button here, and I'll just respond back to Fred and say, can you send me a pic of the other, pardon my typo, of your hands. And I'm Martin, right? There we go. Now, one thing you'll notice is as I was typing, spell check, notice that I spelled other terribly wrong. So we'll just correct that now. Spell check is a component built into your web browser. So depending on your device, Windows, Mac, iPhone, etc., it may behave slightly differently. But what I'm doing here is responding back to the patient and asking for more information. Maybe a photo of the other side isn't that meaningful, but for demonstration purposes, I think that it works. So I'll send that off to the patient now. Now, when I'm sending this message, you'll notice that next to the send button, there's these two options, send from shared account and send from my account. This is really steering where the response will come back to when Fred replies. As I mentioned before, we want patient messages to come back to the shared account, so I'll leave this in its default setting. If I did select send from my account, the issue around that is if Fred replies tomorrow or next week and I've gone on vacation, that message will only be in my inbox and it may not get dealt with in a convenient timeline. So the shared inbox, because it's team-based, is a much more appropriate way to do this. So let's go ahead and send that now. So let's go back to our shared inbox. And there's a couple other messages here. There's one from Barney. Let's see what Barney has to say. He sent us a consent form, and again, I can open up and view this consent form within Brightsquid. I can have a quick preview of it in the secure mail interface. But probably the more likely thing that I'm going to want to do is download this file. There's a download button here. And when I download this file, it'll be saved to somewhere on my computer desktop. Once it's saved onto my computer, I can easily move it into another storage system, like an EMR, for example. I'm not going to go into the details of that in today's conversation. Other video tutorials are available that will explain how to use Secure Mail in conjunction with other specific EMRs. Actually, you know what? I will save that file. There we go. And now it's been saved to my computer. Now, interesting little tip here I want to point out. When the files get downloaded, they get downloaded onto, as I mentioned, onto your computer. But if you ever downloaded a file and then you weren't able to find it afterwards, it can be very frustrating. So I'll show you that when you download files, depending on the browser you're using, I'm using Firefox right now, there's a little down arrow up here in the top right-hand corner that shows you all of your downloaded files and where they're located. So for example, this sample PDF that I just downloaded, I can now click on View Folder, and it'll take me directly to where that file has been saved on my computer. It'll actually open up this kind of a file explorer window, and I can then use that to drag and drop it somewhere else. All right, so that's the receiving of information. In this example, I've gotten something from someone else and I've acted on it, forwarded it, replied to it, or downloaded it and put the information into my EMR. But the question I get more often than any other is, how do I send messages to my patients and colleagues? And do they have to have an account before I do that? Or can I just send messages out willy-nilly? So the answer is, you can invite people to use Secure Mail with you, and you can send messages to those that already have Secure Mail accounts. Let's see how that looks. So again, falling back in my email analogy, in the top right-hand corner here, I'll select Compose. And now we see a composition screen, which I'm sure looks familiar to all of you. And from here, I can address a message to one of those two groups of people. And by those groups, I mean those that have Brightsquid Secure Mail accounts and the rest of the world who don't have one yet. So if I put in something like Fred in the to field, autocomplete finds Fred because he's already in my list of contacts. He's on my buddy list or recently contacted list or whatever you might want to call it. So he pops up right away as soon as I type in Fred. Now, if I type in a different name like Pierre, for example, who's the doctor in the practice I work at, we'd also find Dr. Fauchard, Pierre Fauchard in this case. So that's for connecting with someone who's already in the system. But let's imagine that I have a X-ray that I want to send to my patient for some reason, and they've never used Secure Mail before. How do I begin? Well, all I need is their email address and one other bit of information I'll get to in a moment. So my patient's email address is going to be test user +1. And you'll notice as I'm typing, the system is automatically searching, trying to find matches. And as I type more and more information, we get more specific. Eventually, we're told that there are no matches in recent contacts. So this is where I can continue searching more broadly, that is to say the rest of the Brightsquid community. There's hundreds of thousands of users in the system. So we'll click on continue and still no matches found. So now we're at the invitation step. And this is the point where, as a subscriber, remember I'm Martin at a practice and I'm a subscriber. This is where I can now invite someone to create their own Secure Mail account. So when I click on invite new user, the service asks me to identify my relationship to the person that I'm inviting. Now that sounds very complicated, but all we really mean is, are they a patient or are they a colleague? Now, in this example, this test user is going to be a patient. The other options that are here that probably be used less so are colleagues within my practice. Maybe a new doctor just joined my practice or a new staff member. Generally speaking, the administrators in your office will do this for you. So I wouldn't worry about this one too much. And colleague at another practice, same idea. Certainly you can invite another doctor or a clinician in another city or a province, for example, but we're not going to do that today. We're going to invite our test user +1 as a patient. And this is where that second bit of information comes in. When I invite someone and indicate that they're a patient, we're asked to provide their date of birth as a temporary password or a shared secret that they will use one time when they register their account. Now, you'll notice that I'm not allowed to type in the email or the date of birth. Typing in dates is very ambiguous. For example, a date written as 02031975 is a mystery to me. I don't know if that's February 3rd or March the 2nd. So that's why we've implemented this drop-down box list so that the date is selected in a very unambiguous and specific way. When we invite our test user, they are going to get an email to their regular old-fashioned email address that says, Martin at the Frashard Clinic has sent you a thing. Click here to go and see it. Now, if it's their first time using Secure Mail, that email will take them to the registration page where they'll sign up, use their date of birth, create a password, and then log into their account. If they've used Brightsquid Secure Mail before, even if it was with a different practice, they'll get that notification, and instead of going to the registration page, they'll slide right into the login page and log into their existing account. So let's go ahead and click Add now. Now everything else is identical to traditional email. So in the subject line, I can say test results, or actually, I think I was going to send an X-ray. So X-ray of broken hand. And then let's say our patient's name is going to be Jeff. Dear Jeff, here is that X-ray. Martin. All right, so now I've composed my message. Now you'll notice that when I typed in the message, I was typing in this field here where this closed padlock is. And this closed padlock is what indicates that we're in the secure part of Brightsquid. This is where we can enter PHI, which stands for Protected Health Information. Contrast that with down here with this open padlock, which is where we don't want to enter PHI. This is the actual content or the body of the email notification that will go to Jeff's regular old-fashioned email inbox. We don't want to type any information in here. There's a default boilerplate message built in here, and there's no need to add any information. In fact, I actually discourage it because if you start typing in both boxes, it can be easy to forget which one is the secure section and which is the non-secure. So I really don't recommend editing this information, which is why it was hidden by default. Now, before I can send this message, I've promised Jeff an X-ray. So let's go ahead and on my computer, click on the Browse button here in Secure Mail, and then I can browse my local computer to find the file that I want to attach. Now, in this case, I'm going to go to my desktop and I'll grab this X-ray file that I have here, which is obviously a sample file, and we'll attach that to the outgoing message. That's one way to attach files. I can also, depending on my device, open up my File Explorer, browse to the location where I want to find the file, and I can drag and drop files from my computer into Secure Mail. Now, for those of you that use an EMR, before you can drag and drop files, you'll have to export them from your EMR to an accessible location on your computer. And that accessible location can be your desktop or your My Documents folder, or even a mapped network drive. There's a lot of different ways to approach that. But now I'm done. I've composed my message. We've attached our files. We can see a preview here of the eczema hands again. We can see a preview of the X-ray of whatever this is. And so now we're ready to go. I've confirmed I've got all the information that I want to send to Jeff. And we go ahead and we click send, except I just clicked into the wrong tab. And we go ahead and we click send. Now, before we click send, I'll just remind you that send from my shared account versus send from my account controls where the responses are going to come back to. And we, of course, want to use the shared account. So let's click send now. So now all that healthcare information gets uploaded to Brightsquid. Simultaneously, the email notification is being delivered to Jeff's email inbox, letting him know that something has happened. Now that email notification, just to repeat myself one more time, doesn't include any healthcare data. It's just a notification that says, hey, Jeff, someone at your doctor's office has sent you something. Click here to go and see it. Now, every time you send a Secure Mail message through Secure Mail, there's that two-part configuration. the secure part that goes through our Brightsquid servers, and the non-secure part, the regular old-fashioned email that just bounces around the internet and gets to the user's inbox and lets them know something has happened. In a few minutes, we'll come back and we'll see what Jeff's point of view looks like. But let me continue down the left-hand side of my screen here and talk about a couple of important features. So I talked about the shared inbox, and here's the messages we saw from Fred and Barney earlier. As I mentioned before, this shared inbox is monitored by multiple people within my practice. It's not just my job to deal with Fred and Barney. Much like the phone system within my office, when Fred and Barney sent in their message, they were just sending it to the clinic, the practice, the office, whatever the case may be. And now it's up to us in the office to route and triage those messages. A good way to think of it is much like phone systems. When a patient picks up the telephone and calls the number they find on Google, they're not expecting the doctor to answer the phone. They're expecting to go to the front desk, to an MOA, to a receptionist, and then that person will handle the request and forward it and route it as is appropriate. Exactly the same concept here in Brightsquid Secure Mail in our virtual front desk or shared inbox. Now, most individuals also have a My Inbox. Now, this is your private inbox that messages can be sent only to you. Most of you are probably going to want to turn this inbox off and leave it turned off because we really don't want patients sending messages to specific staff members in a clinic. Because as I mentioned before, if someone sends a message to Marty and it's of an urgent concern about a prescription, for example, and then Marty goes away to Mexico, no one's going to get that message. So there are configuration tools that allow individual users to turn off messages to their private inbox and instead just route them to the shared inbox. And I'll briefly show that in a few minutes. The next couple of things in here are the drafts folder. Now, the drafts folder, as the name implies, this is where messages get stored in draft before they're sent. This is really helpful in situations where you start composing a message, you type a whole bunch of stuff, and then something happens, you get called away from your desk. If you come back later, all the information that you've typed in will be in the drafts folder. It gets saved automatically. You wouldn't want to lose all the work you've written, so this way we can just save it for you. The sent folder, interesting, pretty self-explanatory, but because of the shared inbox and a couple of other bells and whistles, I'm going to spend a little bit of time here in the sent inbox. First and foremost, you'll notice that for this practice, there have been 4 messages sent in the last few minutes or the last couple hours. This one here, sent by Martin McFly, the x-ray of the broken hand, well, that's the one you saw me compose about 5 minutes ago. And if we look at that message here, we can see, Dear Jeff, here's that x-ray, Martin, and so on. Interestingly, we can also see this little orange box next to the recipient's name that shows that the message has not been read. I can't tell you how many comments we get about this read receipt that 100% tells us when the recipient read the message that was sent to them. It's so helpful to be able to determine if I sent something to a patient, gosh, I wonder if they read it. Let me show you the opposite version. If I go down here to this message sent by Wayne a few minutes ago, and now here's a couple of things. First of all, this message wasn't sent by Martin. Remember, I'm Martin right now. This was sent by Wayne, and it was sent to Barney. And there's a little green check mark next to Barney's name that tells me this message was read and exactly what time and date our recipient Barney opened and read this message the first time. So a couple of things there. It's a lot just happened in those 2 mouse clicks. First of all, because I'm using the shared inbox, I can see not only messages that I've sent, but also those that were sent by other members of my organization, in this case, Wayne or Clara or whoever. The read receipt tells me that Barney read this message about his LDL levels at 5:09 p.m. earlier today. So important to be able to tell something has been read. But another really cool thing we can do here in the sent messages folder is if a message is sent in error, we can go ahead and recall that message. So over here on the far right-hand side of my screen, there's a little menu next to the timestamp, and this allows me to recall a message that I perhaps don't want someone to see. Now, I'm not saying this happens all the time, but mistakes happen. I know in my regular email, if I compose a message, I've got 10 people named Mark and 100 Jeffs and a whole bunch of Bobs. And if I'm not paying close enough attention, I can accidentally send an email, happens all the time, to the wrong person. Now, in my regular email, I'm just sending information. It's hopefully nothing too confidential. But when it comes to patient records, it's all confidential. It's all important. And if we send patient health information to the wrong recipient, there's potential risk there. So this ability to recall a message before it's been read is super powerful. And so at any time, I can go into my into my sent folder, see if a message has been read or unread, and if I need to, I can then recall the message. Now, to be clear, whether the message has been read or not, I can still call it back. It's just that I can't erase someone's memory if they've already seen the information. But of course, I can still recall the message and reduce the damage. Okay, moving on. We're just about wrapping up here in just a few more minutes. The trash folder here is where any message you delete goes. Pretty self-explanatory. Really important note about the trash folder, there's no limit. We get phone calls on our help and support desk all the time saying, my trash folder is getting full, and people sound really stressed about it. I think that they're worried that it's like old-fashioned email. Have you ever had an IT person that yelled at you because your trash folder was too big? It's 10 gigabytes, for goodness sake. You have to delete some of your old email. That doesn't matter here. This is all web-based application. We have unlimited storage. So don't worry, you don't need to delete your trash messages. You can have as many as you want. The chat system, that's something still under development. So I'm not going to talk about that today. It hopefully will be released in a few months. Now we get down to our contact section. The directory is a directory of all of the professional users that I may want to communicate with. When you first enter the directory, we display your recently contacted contacts, clinic-wide. So you may have never sent a message to Edward Engel, but someone else in your practice clearly has. So the buddy list here that's being created is of those individuals that have communicated with your practice, either sent or received messages with you. Now, you're not limited to just these folks. As I mentioned, there's a couple 100,000 people on Secure Mail, and you can find them all up here in the global search, which you can constrain by city, state, province, and specialty if you're so inclined. Same holds true for our patients. Any patient that is connected with your practice would be displayed here. Again, it's the recent contacts, the buddy list that we see first. And in this example, we've got Fred and Barney, and then there's this strange little test user individual who has this weird orange icon at the far right of their name. The orange icon indicates that test user +1 has not yet registered their Brightsquid Secure Mail account. It's a pending registration. Contrast that with Fred and Barney that have little blue stars next to their name, which indicates that they are registered and signed up. And this reminds me of an important point that I don't think I mentioned earlier when I was sending out this message. Test user +1 has a brightsquid.com email address. I use that for demonstration purposes just because that's what I have at my disposal. Please don't think that we can only invite people that have Brightsquid email addresses. It can be Gmail or Hotmail or Yahoo or AOL or ABC, whatever you'd like any email address your patients or colleagues have are just fine by us. And I like to make a big point of that because I've been asked that in many occasions. So our test user or test user +1 at brightsquid.com hasn't signed up yet. Now, you may ask yourself, why not? Well, maybe he's been busy. Maybe he tried to sign up and his birthday was wrong. I mentioned earlier on that when we invite someone, when we invite patients, they're challenged to enter their date of birth before they're given access to the healthcare information that was sent to them. To be clear, we don't ask for date of birth numbers for healthcare professionals, because that would be kind of weird to have to call someone and ask their birthday before you can send them a secure mail message. But presumably, patient's dates of birth are in your EMR, so that is easily available at your disposal. But sometimes mistakes happen. Believe it or not, I have seen EMRs with incorrect birth dates in them. So if we sent this message to our test user and they tried to sign up and it didn't work, maybe it's because their birthday was wrong. They get 3 tries and then we have to cancel their invitation. So if a patient calls you back and says, hey, I entered my birthday and it said it was wrong, you do know my birthday is January 2nd, 2000, right? Oh, well, that's not what we have. So we can quickly edit that right here, change the date from the 1st to the 2nd, click save, and that sends a new invitation off to this user, and they can try to re-register again with that corrected date of birth. All right, so we're just about done here. I do want to quickly just touch on the settings options. Most of these are going to be controlled by your administrator, but I wanted to show you here in the personal details for our pal Marty McFly, or sorry, Martin. Down here at the bottom of the screen are the receive messages controls that allow Martin or his administrator to turn on or turn off the ability for patients or professionals to message him. So if both these options are turned off, which I'll now do, anytime anyone addresses a message to Martin McFly within Brightsquid, a little pop-up will appear that says, Martin does not accept direct messages. Click here to address it to the Fauchard Clinic, which of course is where Marty works. So that's how that control works. And that's how we turn off this My Inbox. And there's never going to be another message in Marty's private inbox because everything that tries to go there will get routed up here to the shared inbox. And in the shared inbox, Clara or Wayne or Marty can take care of that information. Now, the doctors that are in this practice are not on the shared inbox team. So they're not being, quote, bothered with incoming patient messages. But the staff within the practice can still forward messages to those doctors if they need to. Interestingly enough, Marty could forward a message to Dr. Fauchard. Dr. Fauchard could reply back to the patient and say, drink more water, take an aspirin, whatever that might be. But when that patient replies, guess what? It still gets routed back to the shared inbox. So it does allow for some one-way communication where a doctor can send a message to a patient, but the patient's reply comes back in and goes through that same triage in the virtual front desk. All right, one last thing and we'll wrap up for today. As I mentioned at the start of this conversation, this is not the only training at your disposal. You can always contact our help and support team. A little question mark icon up here in the top right-hand corner is the help and support portal. And by clicking there, it takes you to where you can get assistance. There are numerous documents and videos and tutorials in this support portal that will explain all of the things I just spent the last half hour talking about. So feel free to peruse this information and look for anything you might need to know. Also, if you scroll to the bottom, you can find our phone number, our support email address, and our live chat button over here in the lower left-hand corner. We are always happy to help, provide training, answer questions, and so on. And to be totally clear, and I have to point this out because I know there's been misunderstandings in the past, we are here to help everyone. Our help and support team is based in Calgary, 8 to 5, Monday to Friday, and we will help our paying subscribers if they're doctors, if they're staff members, if they're a principal in a high school, and if they're patients. Anyone who needs help using Secure Mail is welcome to call us. We're not one of those organizations that will only provide direct technical support over the phone to our paying subscribers. Anyone, anytime, well, anytime is 8 to 5 Monday to Friday right now. That may change later, but we're always happy to help anyone who needs it. All right, that's all for today. If there are any questions, I just showed you how to get in touch with us, and good luck and let us know how it goes. Thank you very much and have a great afternoon.